The cardiac monitor in Bay 6 had been screaming for 11 seconds when everyone in the room stopped moving. Not frozen with purpose. Frozen with the particular helpless paralysis of people who have reached the edge of their training and found nothing waiting on the other side. Dr. Raymond Colt, chief of cardiothoracic surgery at St. Aurelius Medical Center in Dallas, stood at the head of the table with his hands at his sides. His residents flanked him like monuments. 3 of the most expensive medical educations in the state of Texas, standing perfectly still while a man's heart stuttered toward silence. Then a voice came from the corner of the room, quiet, certain. The kind of voice that doesn't ask permission. He's in PEA. You need to open the chest. Right now. Colt turned slowly, the way powerful men turn when they're deciding whether to be insulted or amused. The woman standing near the supply cart was small, maybe 5'4", with dark hair pulled back in a practical braid and the kind of face that people forget at dinner parties. Her scrubs were a shade too large. Her badge read, Wren Daly, CRNA, Certified Registered Nurse Anesthetist. She was the anesthesia nurse. She was supposed to be managing the airway, staying in her lane and keeping her mouth shut during surgical decisions. Colt smiled. It was the smile of a man who had been right about everything for 20 years. Thank you, Daly, he said, in the tone used for waitstaff and new interns. The adults are handling it. Wren Daly looked at the monitor, then at the patient, then at Colt, with eyes that held no anger, no hurt, no plea for validation. Just a flat, unnerving calm that made his smile feel suddenly smaller than it had a moment before. She didn't say another word. She stepped back, adjusted the ventilator settings with 3 precise movements, and watched the room fail. St. Aurelius wasn't the biggest hospital in Dallas, but it had the highest concentration of ego per square foot of any medical facility west of Johns Hopkins. It had ranked in the top 10 of U.S. News and World Report for 11 consecutive years, a fact that appeared on coffee mugs in the administrative wing and on the business cards of people who had nothing to do with patient care. Dr. Raymond Colt had been the public face of that ranking for the last 6 years. He had the jawline for television, the publications for prestige, and the instinct of a man who had learned, early in his career, that the surest path to unchallenged authority was to make everyone around him feel perpetually provisional. Wren Daly had walked into St. Aurelius on a Monday in early March, hired to cover a 6-month staffing gap in the anesthesia department. She was 31. She had a CRNA credential, a master's degree from Vanderbilt, and a demeanor so understated that the charge nurse, a sharp woman named Olive, had pulled her aside on the first day and said, genuinely concerned, "Honey, you're going to have to be a little louder in here, or they will absolutely walk all over you." Wren had thanked her and gone to prep her first room. She didn't tell Olive about the 7 years before nursing school. She didn't mention the 18th Airborne Corps, or the fact that for most of her late 20s, she had been the only medical specialist embedded with a long-range reconnaissance unit operating in places that didn't officially exist. She didn't bring up the 3 field promotions, the classified commendation she wasn't allowed to frame and hang on a wall, or the particular set of skills she had developed performing emergency procedures in conditions that would have made every surgeon in this building weep. She was here to do a job. She intended to do it quietly. Colt made quiet difficult. It started the first week during a pre-op briefing. Wren flagged a patient's recent potassium levels. The numbers suggested a risk of intraoperative arrhythmia, and she wanted a cardiology consult before proceeding. Colt had listened to her present the data with his arms folded and his head tilted in a way that communicated, without words, that he found her reading of the lab's creative. CRNAs worry about potassium, he said to the room rather than to her. Surgeons worry about outcomes. We're on a schedule. They had proceeded. The patient had developed a brief run of tachycardia, on the table that Wren caught and corrected before anyone else had processed what was happening. Colt had not acknowledged it. The second incident happened in the surgical lounge. Wren was reviewing a chart when Colt walked in with 2 of his fellows and began describing the morning's anesthesia setup as perfectly adequate, if you don't mind waiting an extra 4 minutes for induction. The fellows laughed. Wren continued reading her chart. One of the fellows glanced at her, expecting a reaction. She gave him nothing. New anesthesia girl, Colt said, noticing her stillness and apparently finding it provocative. I've been trying to figure out your deal, Daly. Where did you train before Vanderbilt? Military, Wren said, not looking up. Ah, a pause freighted with amusement. So they trained you to be very good at IVs and not much else. She turned a page. Something like that. The fellows exchanged a glance. Even they, shaped as they were in Colt's image, felt the specific discomfort of watching someone be condescending to a person who wasn't reacting the way condescension expected. Colt had moved on. But the pattern had been established, and in a hospital like St. Aurelius, patterns became culture within days. By the end of her second week, Wren was known in the OR suites as Colt's anesthesia nurse, with the emphasis arranged to make clear that it meant something lesser. Residents stopped consulting her on dosing questions. The OR scheduler began bumping her preferred setup times. Small indignities accumulated with the casual efficiency of institutional dismissal. Olive, who had seen everything in 30 years of hospital nursing, watched it happen with a tired shake of her head. He does this, she told Wren during a rare, quiet moment at the end of a long Wednesday. Every time someone comes in who might actually know something, he finds a way to make them small before they can be a threat. She paused. You're not going to quit, are you? No, Wren said simply. Good. Olive handed her a cup of coffee, because the patients need someone who gives a damn more than they need the politics to be comfortable. 3 weeks into her contract, Wren caught a drug interaction that would have caused a patient to code 40 minutes into a procedure. She had flagged it quietly, corrected the protocol, and documented everything without making a scene. The attending physician she'd notified had thanked her. Colt had heard about it secondhand and summoned her to his office, where he'd informed her, with the particular cruelty of someone who wraps weapons in bureaucratic language, that circumventing the surgical team's pharmaceutical decisions without going through proper channels was a liability issue the hospital took very seriously. She had looked at him steadily. The patient's name is Howard Finch. He's 63. He has 3 grandchildren. He went home on Thursday. Colt's jaw had tightened. You do your job, Daly. Let the surgeons do ours. She had walked out. In the corridor, out of his sight, she had stopped for exactly 3 seconds, her hand pressed flat against the cool painted wall, feeling the familiar, bone-deep weight of institutions that confused hierarchy with competence. She had navigated this before, in uniforms and in scrubs, and she knew the calculus. You could fight it loudly and spend all your energy on the fight. Or you could hold the line quietly and wait for the moment when the work spoke for itself, so unmistakably that the noise stopped mattering. She had always chosen the line. She chose it again. And she waited. The night of February 9th arrived the way catastrophes do, in hospitals, sideways, through the door you weren't watching. A winter storm had been downgraded twice by the National Weather Service that afternoon, which meant that by 9 p.m., when it arrived with the full force of something that had not read the forecasts, the Dallas Metro was completely unprepared. Roads glazed to mirrors. A 14-car peel-up on I-35 sent the first wave. A partial roof collapse at a warehouse event venue sent the second. By 9:45, St. Aurelius had declared an internal disaster. Every OR was activated. Every available surgeons, scrub tech, and anesthesia provider had been called back. Wren had been in the building already, covering a late elective case that the storm had delayed. She was in the anesthesia workroom, restocking her cart, when the overhead PA crackled with the mass casualty notification. She had already heard the helicopters. She was in surgical suite 4 by 10 p.m., assigned alongside Colt for a priority trauma. A 58-year-old man named George Talbert, construction foreman. Chest caved in from a steel beam that had come down when the warehouse roof gave way. His injuries were catastrophic: flail chest, cardiac contusion, bilateral pulmonary lacerations, and a penetrating thoracic wound that had been partially stabilized in the field by a paramedic who had clearly done the best anyone could with what was available. Talbert arrived in Suite 4 still alive, which was its own kind of miracle. His pressure was barely holding. His oxygen saturation was drifting. The paramedic who had ridden in with him, a young woman, young enough that Wren noted it, gave a handoff report with her voice cracking from adrenaline and suppressed fear, because she had worked on this man in a parking lot in a blizzard for 20 minutes. And she didn't want to have done all of that for nothing. Wren took the handoff with a hand briefly on the paramedic's arm. "You did good," she said quietly. "We have him." The paramedic nodded, jaw clenched, and retreated. Colt came in fast, gloved, surveying the damage with the practiced assessment of a surgeon who had seen a great deal. For the first 2 minutes, he was efficient, decisive, directing the team through the initial exposure. This was where Colt was genuinely excellent. The visual field, the spatial logic of the body laid open, the geometry of intervention. Wren ran the anesthesia side with quiet precision, adjusting pressors, managing the ventilator, threading the needle between keeping Talbot deeply enough sedated and not tipping his fragile hemodynamics into collapse. They had been working for 20 minutes when Talbot's pressure began to fall. Not gradually, off a cliff. "Pressure's dropping," Wren announced. 62 systolic. "He's losing volume faster than we're replacing it. He's bleeding from the left pulmonary vein," Colt said, leaning in, suction tip working. "Get me a 40 proline." "He's also in early tamponade," Wren said, watching the waveform pattern on her screen, the characteristic dampening. "The pressure paradox. The pericardium is filling. I need you to look at the pericardium, doctor." "Colt, I'm looking at the bleeding pulmonary vein." "Daly, if you fix the vein and the tamponade progresses," he arrests on the table. "I'm aware of how cardiac tamponade works, thank you." Colt's voice had taken on the particular dangerous smoothness of a man who is annoyed and powerful. "Hang 2 units of packed cells and push another round of vasopressors. Give me room to work." Wren pushed the transfusion. She adjusted the vasopressors. She watched the numbers, 58 systolic. The scrub tech, a veteran named Cass, caught Wren's eye across the table. Cass had been in ORs for 19 years. She knew what she was looking at. She said nothing because saying something wasn't her job in this room, but her eyes communicated clearly. "I see it too. 44 systolic." "He's going to arrest," Wren said. "No urgency. No panic." The same tone she had used in places where panic was a luxury no one could afford. "The tamponade is progressing. You need to open the pericardium now." "Vasopressors are not going to correct mechanical compression of the heart, Dr. Colt." She paused 1 beat. "We have maybe 2 minutes." Colt looked up at her across the sterile field. Whatever he saw in her face, or didn't see, no pleading, no deference, just the flat, unblinking certainty of someone who had made calls like this, in conditions he had never been trained to imagine, gave him a half-second of pause. The monitor erupted. "Ventricular fibrillation, the unmistakable chaos of a heart that has lost its rhythm and is now simply vibrating, doing nothing, sustaining nothing." "He's in VFib," the circulating nurse shouted. "Start CPR," Colt began. "No." Wren's voice cut through the room. She was already moving, stepping from behind her anesthesia screen to the right side of the table. "CPR on a filling pericardium is compressions into a balloon. You will rupture the right ventricle. You need to open the pericardium and decompress it now." She looked at Colt directly. "I can talk you through the approach if you need me to. Or you can let me assist and we move in the next 45 seconds. The room held its breath. Raymond Colt was not a coward. Whatever he was, whatever the accumulated weight of his ego had built around him over 2 decades, he was not the kind of man who would let a patient die to win an argument. He had seen that kind in training and had privately despised them. He made the only decision that mattered. "Get on my left," he said. Wren was there before he finished the sentence. What happened in the next 4 minutes was the kind of work that people who do it can never quite explain to people who don't. The pericardium opened. The dark, coffee-ground blood of a contained hemorrhage, accumulated pressure that had been silently crushing George Talbert's heart from the outside, evacuated in a rush. The heart, suddenly uncompressed, twitched. Fibrillated. Wren called the internal defibrillator paddles, placed them with a precision that Colt, who was watching her hands, would think about later that night in the parking lot with something close to awe. The shock was delivered. 1. 2. On the second shock, the monitor changed. Sinus rhythm. Weak, but sinus. "Pressure's coming up," the circulating nurse said, voice barely above a whisper. 70. 82/50. Nobody cheered, they were professionals. But Cass, the scrub tech with 19 years and no illusions, allowed herself one slow exhale that said everything. Colt stood back for a moment, looking at George Talbert's beating heart. "Suture the pericardium loosely," he said. "Leave drainage, then we finish the pulmonary vein." "Yes, doctor," Wren said, already in position. They worked for another 2 hours. When it was over, when the final suture was placed, and the drapes came down, and George Talbert, construction foreman, father of 4, grandfather of 1 with another on the way, was being moved to the cardiothoracic ICU, with a blood pressure that a body could actually live on. Colt stood at the scrub sink, removing his gown. He didn't look at Wren. He didn't say anything. She hadn't expected him to. She peeled her gloves, dropped them in the bin, and began her post-anesthesia documentation with the same unhurried focus she brought to everything. Cass caught her eye one more time from across the room and gave her a single nod that contained a complete sentence. Wren nodded back. She was in the anesthesia workroom at 3:40 in the morning, finishing charts on 2 other cases she'd covered during the disaster protocol when the door opened. She expected Olive, who had been circulating all night and had a habit of checking in with a kind word and bad vending machine coffee. It was not Olive. The man who stepped into the workroom was in his 60s, carrying himself with the particular uprightness of someone for whom posture had been a professional obligation for so long it had become structural. He was in civilian clothes, dark jacket, open collar, but the bearing was unmistakable. Wren recognized it the way veterans recognize each other, the specific geometry of a person shaped by institutional discipline, so thorough it never fully leaves. She had seen his face before. She searched her memory with the same efficient indexing she applied to drug interactions and ventilator settings, and found it in 3 seconds. Vice Admiral Leonard Greer, USN retired. Former commander, Naval Special Warfare Command. She had seen him once at a Joint Task Force briefing in a SIF in Bagram, 8 years ago, when she was a staff sergeant attached to a unit he'd been overseeing, and she had been the most junior person in the room by a decade. He looked at her the same way the general had looked at Bianca, with the sudden clarity of recognition recontextualizing everything he'd seen in the last few hours. "I was in the gallery," he said. His voice was exactly what she would have predicted, measured. No wasted words. "My brother-in-law is George Talbert." Wren set down her pen. "He's stable. The ICU team will give you a full update." "I've spoken to the ICU team." Greer stepped further into the room, and to the OR nurse who was in the room, the one who's been here 19 years. He paused. "She told me what happened." Wren said nothing. "She told me the anesthesia nurse saw the tamponade when the surgeon missed it. She told me the anesthesia nurse called it twice, was dismissed twice, and then when the patient coded, she was the one who knew how to fix it." He stopped. "She said the surgeon would not have known what to do without her." "Dr. Colt is an excellent surgeon," Wren said. "He made the right call when it mattered." Greer studied her for a moment. "That's a generous reading. It's an accurate one. He saved George Talbert. I assisted." That's not quite how Cass described it. Greer looked at her with the evaluating gaze of a man who had spent a career assessing people under pressure. "I'm not going to be able to talk you into accepting a different version of tonight, am I?" "No, sir." A long beat, then something shifted in the Vice Admiral's face. Not softening exactly, but the particular quality of respect that surfaces when someone meets a standard that wasn't expected. "What unit?" he asked. She told him. His eyebrows moved slightly, just slightly. "I read about a medical specialist from that unit. After the thing Kandahar Province 2019. The one where the helicopter went down and she kept 3 operators alive for 6 hours with a field kit and a flashlight." He paused. "They gave her a citation no one is allowed to talk about." Wren picked up her pen. "I have documentation to finish." Greer looked at her for another moment. Then he nodded once, a slow, deliberate nod that communicated a great deal, and turned to leave. At the door, he stopped. "The hospital's chief medical officer is a friend of mine," he said, not turning around. "I've already asked for a meeting tomorrow morning. I intend to tell him what I saw tonight, and what I was told by the people who were in that room." Wren was already looking at her chart. "That's your right, sir." "The woman who kept my brother-in-law alive," Greer said quietly. should not be referred to as an anesthesia nurse in a tone that means something small. That's not right, and I'm going to say so." He left. Wren sat with that for a moment. Then she went back to her documentation. The meeting Greer had requested took place at 9 the following morning, in a conference room on the executive floor that had a view of downtown Dallas, and photographs of the hospital's benefactors on every wall. Present: Chief Medical Officer, Dr. Philip Marr, Dr. Raymond Colt, the Director of Surgical Services, the Risk Management Officer, and, at Greer's specific request, Wren Daly. Wren arrived 2 minutes early with a cup of coffee she'd made herself and sat in the chair nearest the door, which was not the chair anyone had intended for her. Colt came in 30 seconds later. He saw her. He said nothing. Greer arrived with the quiet devastation of a man who has spent his career in rooms where the stakes were considerably higher than these. He had brought nothing with him. No paperwork, no documentation, no theater. He took a seat and looked at Marr. "I'll be brief," he said. "Last night, my brother-in-law, George Talbot, was brought in with traumatic cardiac injuries." He coded on the table. "The intervention that saved his life was identified and initiated by the anesthesia nurse in the room over the objections of the attending surgeon." He paused. "I have spoken to 3 people who were present. Their accounts are consistent." He looked at Colt. "I have no interest in destroying anyone's career, Dr. Colt. I am here to say that what I've described should not be possible in a hospital with this institution's reputation, and I'm here to ask what you intend to do about it." The risk management officer started to say something about process. Greer let him finish. Then he said, "I'm also here to tell you that I have a conversation scheduled with the Medical Advisory Board of the Texas Department of State Health Services next week, at which I will be asked about my brother-in-law's care. I would prefer to be able to tell them a complete story, including how this institution responded when the issue was raised." The room recalibrated. Marr looked at Colt. Colt was looking at the table. He had the look of a man engaged in a very private, very unpleasant conversation with himself. "Dr. Colt," Marr said carefully, "I think this conversation requires your contribution." Colt was quiet for a moment that stretched long enough to become significant. When he spoke, it was not what anyone in the room had anticipated. "She called it twice," he said. "I dismissed it twice." He said it to the table, not to the room. "She was right. I was wrong. The patient is alive because she was in that OR." He paused. That's the whole story. The silence that followed was the particular quality of silence that arrives after something that cannot be taken back. Marr looked at Wren. "Ms. Daly, is there anything you'd like to add?" "No," she said. "Just that the paramedic who stabilized Mr. Talbot in the field deserves recognition. Her work bought us the margin we needed. Her name is in the handoff report." Marr blinked. He had expected perhaps demands, recriminations. He had not expected her to use her moment to redirect the credit towards someone who wasn't in the room. Greer was watching her with an expression that was not quite a smile, but was its neighbor. The meeting ended with 3 outcomes. A formal review of the incident to be conducted without prejudice, a recommendation to the Surgical Services Director to establish a structured rapid response protocol that included anesthesia input on emergent cardiac decision-making, and an offer, not a requirement, Marr was careful to say an offer, for Wren to extend her contract and take on a formal role as clinical lead for the anesthesia team during mass casualty activations. Colt, on his way out, stopped beside her chair. He didn't sit. He didn't look entirely comfortable, which was probably the most honest he'd looked in a professional setting in years. "The pericardial approach you used for the defibrillator placement," he said. "Where did you learn that?" "Field medicine," Wren said. Sick slowly. Said nothing else. Walked out. George Talbot was moved out of the CTICU on day 4 to a step-down unit where his wife, Jeannie, had maintained a continuous vigil with the particular ferocious constancy of a woman who has decided that her presence itself is a medical intervention. His daughter and son-in-law had driven up from San Antonio on the first night and hadn't gone back. His grandchild, not yet born, made her presence known in other ways. Wren stopped by on day 5, which she had not intended to do. She was passing the step-down unit on her way to the elevator when Jannie Talbot stepped into the hall and simply said, You're the one who was in the OR. It was not a question. Wren stopped. I was part of the team. Jeannie looked at her for a long moment with the evaluating gaze of a woman who had been married to a construction foreman for 34 years and had developed, through proximity to a man who worked with his hands in unforgiving conditions, an excellent instinct for who actually did the work and who took the credit. Leonard told me, Jeannie said. Admiral Greer, George's sister's husband. She paused. He told me the truth. Wren didn't say anything. Jeannie stopped. Her composure was intact, but barely, and only through long practice. I just wanted to say thank you. To the right person. Directly. Wren accepted the thanks without deflecting it, and without expanding it into anything larger. He's a tough man, she said. He did most of the work himself. Jeannie laughed, which broke the emotion into something manageable. Lord, don't let him hear you say that. His head's already too big in there. Wren smiled. It changed her face considerably. She accepted the contract extension on a Tuesday morning, signing the paperwork with the same unadorned practicality she brought to everything. Olive made a cake, which was excessive and perfect. Cass from the OR brought coffee that was actually good, which was rarer. Nobody made a speech. Wren would have found a speech unbearable. But in the break room, when the small celebration had quieted and most people had drifted back to their work, Olive sat down across from her and said, I owe you an apology. Wren looked up from her coffee. For what? The first day, I told you that you needed to be louder, that you'd get walked over if you were quiet. Olive shook her head. I was wrong. You were never quiet because you were afraid. You were quiet because you'd already decided what mattered. Wren considered this for a moment. You weren't wrong, she said finally. Some places, loud is survival. I just spent enough time in places where quiet kept people alive that I stopped being able to tell the difference. Olive looked at her for a long moment. Then she nodded in the way of people who have arrived at an understanding without having fully mapped the route. They drank their coffee. Outside the break room window, Dallas was beginning to thaw. The ice that had turned the city into a crash site was retreating from the glass and the pavement and the roads. Slowly, the way all the hard things eventually do. Not all at once, but patch by patch, until one morning you looked out and the ground was clear again. George Talbert would be home by the end of the month. His granddaughter would be born in April. In the cardiac step-down unit, the nurse on duty noted his vitals at the top of the hour, and they were unremarkable in the way that the continuation of a life is always, on paper, unremarkable. Some things only look like miracles from the outside. From the inside, from the side of the person who did the work, it just looked like knowing what to do, and doing it in the time that was available. Wren Daly poured the rest of her coffee down the sink, rinsed the cup, put it on the drying rack, and went back to work. Quiet isn't the same thing as invisible, and the ones who know the difference between those two things are exactly the people you want in the room. When the monitor starts to scream.